So hi everyone, my name is Jerry Vitek. I'm the head of the Department of Neurology at the University of Minnesota. I'm also a movement disorder specialist, and what I'm here to talk about is our movement disorders program, but a little bit also probably about the department. The department is really patterned after my mentor, which is Maitland DeLong. Maitland DeLong is a movement disorder neurologist, expert in basal ganglia disorders. And I trained with him for probably 17 years. I was with him. And he taught me a lot about how to develop programs, and what the most important thing is mentoring. Finding a mentor, and a mentor can make a world of difference in this field, in any field for that matter. What's also important about the mentors are that you can work with your mentor. They're good people. And I will tell you that having traveled around the country training at multiple different places, at Hopkins, at Emory University, and at the Cleveland Clinic, that I think the program we have at the University of Minnesota is next to none. I think we have an outstanding program. You have the opportunity to do a variety of things here. It's important in the first year. We usually do a 2-year fellowship. The first year is strictly understanding and learning movement disorders. The second year, you need to be able to look at doing potentially a clinical research program. You can do a preclinical research program while you see patients in the second year as well. So that's the focus. Again, to learn movement disorders, number one, but to give you the opportunity, if you wish to do clinical research or do preclinical research based on the background upon which you come in on. In addition to bread and butter movement disorders, we have a strong deep brain stimulation program. So we have 3 or 4 people that actually go in the operating room, do intraoperative physiology. There are multiple clinical trials related to deep brain stimulation, but also clinical movement disorders. We actually have separate clinics here for Huntington's disease, spinocerebellar ataxia, but also we have strong collaborations across the university system. We work closely with biomedical engineers for some of our projects, particularly in deep brain stimulation. We have close relationships with psychiatry, because a lot of the work we look at and do in deep brain stimulation involves cognitive processes. But in Parkinson's disease or other movement disorders, there's also cognitive issues. So working close with psychiatry colleagues can be a real benefit, and we have that. We work closely with imagers. For example, the Center for Magnetic Resonance Research at the University of Minnesota is a real Cinderella program in terms of what they offer here. They have some of the best imaging in the country, frankly, in the world. They would argue they're number one. I think Max Planck would argue in Germany that they're number one, so at least they're number 1 or 2. But it's a very strong program. They have 7 Tesla units that are clinical units, so we can basically use the 7 Tesla to do imaging on our patients that are undergoing DBS or need images to help us assess our patients in movement disorders. They have a 10.5 Tesla unit now that we actually use for preclinical studies, and some patients are actually put into the 10.5 as well, based upon the question that you're asking. Maybe you want to look at things in public health, epidemiology, global health. All of this is available based on your interest. Let me tell you a little bit about the research programs that we have, not only in the department, but a lot of them are focused on movement disorders, some of the stuff I'm going to talk about. Number one, we are Udall Parkinson's Disease Center of Excellence, and the goal of that Udall is to understand the circuits involved in Parkinson's disease, both motor and cognitive circuits, to understand how deep brain stimulation works, and to combine the two things to make deep brain stimulation more effective and consistent, to be able to improve not only the typical motor signs we see, like tremor, bradykinesia, rigidity, but also some of the more intractable things such as speech, cognition, sleep, and gait disorders. And all of these things are areas that are being studied right now, either preclinically or clinically. On the clinical side, we actually do studies in the operating room. We look at what's going on between the basal ganglia, so the GPI or the globus pallidus, and the subthalamic nucleus, and cortical areas. So we put ECOG arrays in over the cortex. We have a DBS lead or a microelectrode in the subcortical structures, and we're looking at how the activity in one site is connected to activity in the other site. We also do externalization, so after a person's implanted, we actually have a connector that connects from the lead, goes down through the neck, underneath the skin, and comes out around the abdomen, and we can plug in with like a USB port and record local field potentials. And these patients are put into a place called the clinical research unit, which is like a GCRC, if you've ever heard about those. But basically, it's like an inpatient unit for clinical studies. It's in the Phillips Wangenstein building, right where we have our offices. And in that building, we can externalize these patients, record the biomarker activity or local field potentials from the structure we implanted. And some of the patients we will have an ECOG array in, and we'll be able to give them medication so they turn on, what happens when they turn off and become symptomatic, when we turn on stimulation, when we do different patterns of stimulation, to understand how these subcortical and cortical areas are talking to each other. And when we improve the motor signs, how does that change? And then how can we consistently do that from patient to patient? There's a lot of work that's being done on the preclinical side, also in animal models of Parkinson's disease. There are multiple grants looking at sleep, patterns of stimulation, the pathophysiology, how DBS works. Again, on the preclinical side, but also very heavily on the human side. So there's a fair amount of work that's being done on systems neuroscience in this program. So if you are a systems neuroscientist and you're interested in movement, I frankly can't think of a better place for you to be if this is the kind of work that you're looking to do going forward. Now, every place I've ever gone, I've always heard that story. I've heard that, oh, everybody's collegial. Well, that's not always true. Not every place is strongly collegial. But I will tell you that this place truly is. And I couldn't be prouder of this group. I would put this movement disorders division next to any movement disorders division in the country, frankly. Again, if you have any questions about this program, I'm always going to be available for a call or an email. We can give you that information. Happy to do it. And I think we would welcome you with open arms, and I think you'd feel like you're a part of the movement disorder family at the University of Minnesota.